Leakage of urine. Why? Urinary incontinence is the involuntary leakage of urine. It means a person urinates when they do not want to. Control over the urinary sphincter is either lost or weakened. Urinary incontinence is a common problem that affects many people. According to the American Urological Association, 1/4 to 1/3 of men and women in the United States experience urinary incontinence. Urinary incontinence is more common among men and women. An estimated 30% of females aged 30 to 60 are thought to suffer from it, compared to 1.5 to 5% of men. What is urinary incontinence? Urinary incontinence is when a person cannot prevent urine from leaking out. It can be due to stress factors such as coughing. It can happen during and after pregnancy, and it is more common with conditions such as obesity. The chances of it happening increase with age. Bladder control and pelvic floor or Kegel exercises can help prevent or reduce it. Causes. The causes and the type of incontinence are closely linked. Stress incontinence. Factors include pregnancy and childbirth, menopause, as falling estrogen can make the muscles weaker, hysterectomy and some other surgical procedures, age, obesity. Urge incontinence. The following causes of urge incontinence have been identified: cystitis and inflammation of the lining of the bladder, neurological conditions such as multiple sclerosis or MS, stroke and Parkinson's disease, enlarged prostate which can cause the bladder to drop and the urethra to become irritated. Overflow incontinence. This happens when there is an obstruction or blockage to the bladder. The following may cause an obstruction: an enlarged prostate gland, a tumor pressing against the bladder, urinary stones, constipation, urinary incontinence surgery which went too far. Total incontinence. This can result from an anatomical defect present from birth, a spinal cord injury that impairs the nerve signals between the brain and the bladder, a fistula, when a tube or channel develops between the bladder and a nearby area, usually the vagina. Other causes. This include some medications, especially some diuretics, antihypertensive drugs, sleeping tablets, sedatives, and muscle relaxant, alcohol, urinary tract infections or UTIs. Symptoms. The main symptom is the unintentional release or leakage of urine. When and how this occurs will depend on the type of urinary incontinence. Stress incontinence. This is the most common kind of urinary incontinence, especially among women who have given birth or gone through the menopause. In this case, stress refers to physical pressure rather than mental stress. When the bladder and muscles involved in urinary control are placed under sudden extra pressure, and the person may urinate involuntarily. The following actions may trigger stress incontinence: coughing, sneezing or loving, heavy lifting, exercise. Urge incontinence, also known as reflex incontinence or overactive bladder. This is the second most common type of urinary incontinence. There is a sudden involuntary contraction of the muscular wall of the bladder that causes an urge to urinate that cannot be stopped. When the urge to urinate comes, the person has a very short time before the urine is released, regardless of what they try to do. The urge to urinate may be caused by a sudden change in position, the sound of running water, sex, especially during orgasm. Bladder muscles can activate involuntarily because of damage to the nerves of the bladder, the nervous system, or to the muscles themselves. Overflow incontinence. This is more common in men with prostate gland problems, a damaged bladder or a blocked urethra. An enlarged prostate gland can obstruct the bladder. The bladder cannot hold as much urine as the body is making, or the bladder cannot empty completely, causing small amounts of urinary leakage. Often, patients will need to urinate frequently, and they may experience dribbling or a constant dripping of urine from the urethra. Mixed incontinence. There will be symptoms of both stress and urge incontinence. Functional incontinence. With functional incontinence, the person knows there is a need to urinate but cannot make it to the bathroom in time due to a mobility problem. Common causes of functional incontinence include confusion, dementia, poor eyesight or mobility, poor dexterity, making it hard to cannot unbutton the pants. Depression, anxiety or anger can lead to an unwillingness to use the bathroom. Functional incontinence is more prevalent among elderly people and is common in nursing homes. Total incontinence. This either means that the person leaks urine continuously or has periodic uncontrollable leaking of large amounts of urine. The patient may have a congenital problem or born with a defect. There may be an injury to the spinal cord or urinary system, or there may be a hole or fistula between the bladder and, for example, the vagina. Complications. The inability to retain urine can sometimes lead to discomfort, embarrassment, and sometimes other physical problems. This include skin problems. A person with urinary incontinence is more likely to have skin sores, rashes, and infections because the skin is wet or damp most of the time. This is bad for wound healing and also promotes fungal infections. Urinary tract infections. Long-term use of a urinary catheter significantly increases the risk of infection. Prolapse. Part of the vagina, bladder, and sometimes the urethra can fall into the entrance of the vagina. This is usually caused by weakened pelvic floor muscles. Embarrassment can cause people to withdraw socially, and this can lead to depression. Anyone who is concerned about urinary incontinence should see a doctor, as help may be available.